So here's a 21-year-old male athlete. He has a history of injury while lifting weights. 2 months prior to the initial visit, he hurt his lower back. He's got pain in his left glute, left knee, and left lateral leg. Left foot dorsiflexion is weak. He actually had an 80% improvement in foot drop by the time he came in, so he was improved already. Bilateral hamstring tightness, and here are the findings. He already had an MRI done by the time he came in. The MRI revealed degenerative and bulging discs at L3 to L4 and L4 and L5. He had a right hypertropia and a left head tilt. He had a left palatal paresis, a right chorectasia, right pupil fast-failed and was brisk in response to light. He had left blood pressure was higher on the systolic by 12 points. Cold hands and feet. He had no patellar reflex, and the left finger tap he actually had mirroring with the right hand. So on left finger tap, the right hand was mirroring. Pursuits were smooth and optokinetic responses were good in all directions. Initial saccadometry results. Position profile was good. So he's in range. We want a range of 18 to 22 would be considered normal. His latency profile, here we want the initiation of movement to begin between 100 and 200 milliseconds. And he's got a handful that are past that 200, but we could say that the majority are within a good, healthy range. Initial saccadometry. His velocity is good, but if you look at the green lines and the red lines, so the green is our saccades to the right, and the red are saccades to the left, you could say that they're not equal. They don't move at the same speed. So the left one are a little bit faster than the green ones, which are the right saccades, are a little bit faster than the left saccades. So in this case, it's a matter of choosing, are we going to deal with the red ones or the green ones? Are the green ones a little too fast, or are the red ones too slow? And I made that decision based on a combination of all of my findings. And since he's got some left brainstem findings, I decided that I would go after the left one. That just made more sense to really build up speed and efficiency in the left brainstem in this case. So, and you can see that again here in the face profile. So my strategy is, or my goal initially, would be to activate the left pontomedullary reticular formation, and my hope here is that it will reduce the blood pressure on the left side, decrease that flexor tone. A lot of his complaints are actually in the left, psoas muscle, left hip and left piriformis region and glute. And so even though there is an actual physical, structural, local problem there in his lower back that is really feeding a lot of that discomfort and also the muscular compensation, I think there also is a central component that compounded on top of that is enhancing the problem. So same with the head tilt. I want to improve the head tilt and that right hypertropia as well, and improve the speed of those leftward saccades. So that's my initial goal. Once the blood pressure equalizes, then I would like to transition to doing the right brain eye exercises. At this point, I'm trying to avoid activating the right mesencephalon, since he already has a high blood pressure on the left side and a weak pontomedullary reticular formation on the left side. So that is my strategy, and the treatment plan would be to do left arm and leg counterphase infinities we'll begin with 3 sets of 10, at least 3 times a day. Left horizontal microsaccades preceded by a right Hail Maggie. And my thought process here is that I just wanted to tap into an efficient right Hail Maggie or VOR to increase the speed of the left horizontal saccades. And so that was my initial thought process. And we're of course going to do a spinal decompression protocol with proper physical rehab strategies as well to deal with the local structural problem in the lower back with the discs that are compressed and bulging. So the second saccadometry that was performed the following week, and so this is about 6 days later. And again, the position profile is within normal range, but we're seeing that those right ones are, maybe there's a handful that are slightly hypermetric. So we're seeing a little bit of a change here. That's I would look at that and say that's a negative change compared to the original position profile. Still doing pretty good with the latencies, and velocities are improved. So you could say that they're much more symmetrical compared to the original test. And again, here there's that slight intrusion on the green lines here, right around that 18-degree mark here. You could see that there's a slight intrusion, and that was there on the original test, but it looks like it's improved compared to the first one. So exam findings: his pain's improving. He's feeling better. His head tilt is greatly reduced, if not gone, I think, by this point. He's got a slight right hypertropia. The things that have not changed are the left palatal paresis, the left pyramidal distribution of weakness, the right coarctasia is still there, and the blood pressure is still out of balance. So my strategy is not working at this point to help reduce the blood pressure on the left side. So I make some changes, and I decided to continue with the left counterphase infinities, mostly because by activating that left cerebellum, we're directly having an influence directly on that left PMRF, and I feel like this would be a good thing to keep doing. His presentation is mostly a left cerebellum and right cortex presentation, so continuing those infinities on the left is a good thing. And I decided to also go ahead and start implementing the Carrick right brain eye exercises. My horizontal eye exercise strategy to activate that left pons is really not working. Maybe part of the problem is that I was doing a Hail Maggie to the right, and that might have been activating the opposite side a little bit too much. But either way, I decided to do away with the Hail Maggie and to continue the disc decompression and rehab protocol. And my exam findings on, this was 3 days later, so June 8th, his blood pressure actually is now lower on the left side compared to the right. We could say that overall his blood pressure was a little higher than it has been, but significantly improved in terms of balance left to right, which is great. He's got a subtle right hypertropia, no head tilt, no palatal paresis, no pyramidal distribution of weakness, no coarctasia, no weakness on the left foot, dorsiflexion, and his symptoms continue to improve. So obviously we can say here that, his symptoms have been improving since the beginning, so the symptoms are not necessarily a very good gauge as to how he's progressing centrally or neurologically. So the third saccadometry was performed on June 22nd. Position profile still within normal range. I've got that separation here still between the red and the greens, and I didn't have that initially, so that bothers me a little bit. But as you can see, or as you will see, it continues to improve in other ways, so I'm not getting too overwhelmed by that change. since it's still considered within normal parameters. His latency latency is much better. It's much tighter. You can see that they're grouped together much better. And I mean, he still has a handful that are past 200, but overall that is definitely his best reading. Now let's look at the velocity. All right, so this is the velocity profile. You could see that that intrusion on the right, so those green lines are I mean, there's almost no intrusion there. And the red lines, which are really the leftward saccades, are faster than the right ones. So the left one, those red ones, used to be the slow ones, and now they're definitely improved. Looking at the face profile again, so we've got a slight separation. We want them to run together, but you know, considering that the left saccades were slower before and now they're faster, I'm actually happy with that change. We're not done treating, and we're still continuing to make some changes and looking for progress. But at this point, this is a definite improvement from our starting point. So here's a comparison of the initial to final velocity profile. The initial one, you can see the clear separation here on the left. That was the May 29th, and then the final reading, or the last reading to date, was much improved, and you can see that again with the face profile comparison. So that is really the effect of you know, those right brain exercises. And so let me just show you in the focus builder exactly what that looks like. Initially, when we started, just to kind of quickly show you what I did the first time, I just went into the saccades here, and I had settings specifically set to make 6 saccades with random interval, and I'm using gap saccades, which are express saccades. Okay, and initially I made the pause a little longer so that he could do that right Hal Maggie, and then you'll see that the timing of each saccade here is different, so it's random. And that was the initial one, and that didn't work out too well, so I went ahead and fairly quickly changed to our right brain exercises. And what that means is that the saccades are going to move up and to the left, and again we've got the random settings. I changed the amplitude of the saccades of movement, and really what that means is how many saccades we're going to have across the screen. In this case it's 4, so we went from 6 to 4. The fewer saccades, the larger the saccade, or the longer it will be, and the more speed you're going to gain. So in this case, making them a little longer was helpful, and really did help increase the speed. So this is exactly what that looks like. So from the bottom right corner, we're going to move up with 4 microsaccades up into the left, and then we're going to pursue back down into the right. And so that is the Carrick right brain eye exercise.